I definitely want to clean it out. I definitely want to stain that eyeball to make sure that the cornea is intact and we don't have any ulceration. And then we'll just go from there. Okay? Welcome back to another YouTube channel. Today we're examining an eye. So this baby has had chronic habronema or summer sore on the medial handles of the eye that we have been treating in the past. The owner kind of noticed a little bit of, again, like an inflammation, and she really thought it looked like a summer sore again. And she had summer sore mist in the household, and she put the summer sore mix in the eye. And now it caused a really bad reaction of inflammation, of probably some abscessing. There's a really bad discharge. So today we're going to examine that eye because summer sore mix should not be placed of the eye. There are some medications that can be very irritating for the cornea, for the eye glove per se. So we're going to definitely start this patient on some anti-inflammatories, look at that eye, probably some antibiotics. So let's see how it's looking. They're called the meibomian glands. And those glands can get abscessed. So who knows if the swollen eyelid that you have seen for life is that she occasionally has those eyelids get abscessed and get inflamed. And so sometimes, you know, we can treat it with some anti-inflammatories and antibiotics. But if they get infected, then a doctor would have to come in, probably express it, or probably do antibiotic treatment. So it's probably what she has. She has chronic gland inflammation.
I noticed she's got a little start of a dinosaur or something there. Could I put something on it?
Yes, we'll put some cream. I'll clean it and we'll put some cream on it. But definitely we'll flush out those eyes as good as we can.
And that's so much better already.
Yeah.
Now that you cleaned it, flushed it.
Definitely feels better.
And don't forget the other eye.
Yeah, we'll do both. We'll do both, and we'll do both lacrimal ducts. Because I don't know if anything went through that lacrimal duct as well.
Now that you mention it, when he stained the eye, he said that you might see green coming out of it.
But it never did. It doesn't always happen.
Okay.
But if it happens, it means those lacrimal ducts are functioning amazingly.
Yes, I never did see any.
If there's any inflammation or if they're blocked by any mucus or anything like that, then you won't see it. At this moment, we didn't see it, so there's high possibility that we have inflammation or that it's blocked with some mucus.
What is the white mucusy looking stuff? She's got it in both eyes.
So that, sometimes I have to examine it really closely. Sometimes it could be summer sore. Sometimes it could just be
larva.
Yeah, yeah.
Because I tried getting it out a couple of times with the Q-tip and it.
Sometimes could be that, or sometimes it's just like discharge buildup that would be like pus buildup.
She definitely got it in this eye.
Yeah, and I see it on this one. Yeah, and I'll clean it really, really nicely, and we'll see what we find in there. Good news is that cornea is intact. Okay, so that's the best use that we have at this moment. This may turn into an abscess. I may need to poke it. We'll see. So they have glands all over the top and the bottom. And those glands can abscess, which would mean they got infected. She normally has an issue that her glands get inflamed and then reduce in size. So she is a patient that probably her glands get abscess every now and then. And if we don't do a correct treatment protocol, then they get pus filled. The owner, since it has a lot of moisture on that region because of lacrimation, etc., flies love to go there and lay some eggs, which is the habronema, the summer sore. So she has had a lot of summer sore issues as well on her eyes, which we have treated in the past. But since she has that issue of having so many summer sores, the owner put summer sore cream surrounding the eye, and accidentally that fell inside the eye. So since that mix has a lot of components that can be very harmful to the surrounding tissues and to the eye globe per se, then that's why we want to treat this quickly with some anti-inflammatories, dilute it as much as we can, and you know, do everything necessary, and maybe even incorporate antibiotics depending on how bad it is. We're going to do a AP block, auriculo-palpebral block. It will block the motor function of the eyelid, so it would let me open up that eyelid. So now after I did that block, now the motor function of this eyelid is more controlled. They have really strong eyelid. Therefore now I can open it with less resistance, which is what I wanted. So I can actually look in there, flush everything in there very nicely with less stress, you know? I didn't put a lot. But I put as much as I could, you know, manipulate her, which is what I wanted. Oh, sorry, Roy.
Good flush. Good flush. Yeah.
Now I'm gonna do the nasolacrimal duct. We're cleaning out the eye ducts, which connects the eye to the nose. On this one, it wasn't working, and now it's actually working. So we see some fluid coming out the bottom, which honestly I can't see it right now. Oh, and we have some fluid coming out there. There's a little hole here, and there's something in it, and we want to see exactly what it is.
What is that?
It feels...
What is that?
I don't know.
A worm?
No.
Is it hard?
Yeah, but not too hard.
Looks like a worm to me.
After examining the eye globe, the conjunctiva, which is the surrounding soft tissue, and the nasolacrimal duct, we came to a conclusion that this patient has a mixture of habronema, severe inflammation, and then we have to investigate once we decrease that severe inflammation, what is our next step? Mainly with habronemas, we have to go in there and debride it. Since that's a really sensitive and complicated area, then we're going to refer her to the surgeon so that the surgeon can look at that area and probably debride it and, you know, do as best as possible. For now, what we're going to do is we're going to do anti-inflammatories, and we're also going to do Neopolydex, which is it's an ointment that will have steroids, it will have anti-inflammatory and antibiotic properties, so we can continue reducing that inflammatory phase and then go from there. But apart from that, I'm really happy that both eye globes are intact. So the cornea is intact. There's no ulceration, no scrapes, no anything like that. So we're mainly dealing with that soft tissue surrounding, which is really inflamed, and that we have that summer sore on that lower eyelid. So for now, we have a good prognosis that we're not going to go blind, but then we have to deal with that habronema in the future. If you like videos like this, tap in, follow, subscribe, all those good things.